From San Diego, California, Miss Olivia Ramirez.
Give me your attention, baby. I gotta tell you a little something about yourself. You're wonderful, flawless, you're a sexy lady. But you walk around here like you wanna be someone else. Oh, 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 girl, I'm gonna show you when you're fine, so fine.
Fine, so fine.
Oh, 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 girl, I'm gonna show you when you're mine, oh, mine.
Mine, oh mine.
Treasure, that is what you are. Honey, you're my golden star. You can make my wish come true if you let me treasure you. If you let me treasure you. Oh, oh. Pretty girl, you're smiling. A girl like you should never look so blue. You're everything I see in my dreams. I would say that to you if it wasn't true. Oh, 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 girl, I'm gonna show you when you're fine, so fine.
Fine, so fine.
Oh, 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 girl, I'm gonna show you when you're mine, oh, mine.
Mine, oh mine.
Treasure, that is what you are. Honey, you're my golden star. You can make my wish come true if you let me treasure you. If you let me treasure you. Oh, oh. You are my treasure. You are my treasure. You are my treasure. Yeah, you are my treasure. You are my treasure. You are my treasure. Yeah, you are treasure. That is what you are. Honey, you're my golden star. Make my wish come true. If you let me treasure you. If you let me treasure you. Oh, oh. Thank you.
Yeah.
Okay, wow, that was Miss Olivia Ramirez from San Diego, California. And of course, can we
hometown.
invite Olivia to come over, to come here on
Yes.
stage?
Yes.
And of course the mother, the
mother,
proud
Miss
mother.
Literally,
Yes.
From the hometown of Jessica Sanchez, right?
Yes,
Yeah,
yes,
that's
yes.
what part of San Diego is that?
We're from Chula Vista,
Chula
San
Vista.
Diego, yes.
Okay.
Yes. And same hometown
And
as
how
Jessica
old is she?
Sanchez. She's 10 years old.
10 years
10 years old.
Wow.
Yes, and she's been taking voice lessons for about 4 years now.
4 years.
yeah.
Wow.
4
That,
years.
with, is there any particular mentor that she's?
She has been taking voice lessons from a well-known vocal coach. His name is Raleigh De Leon,
Raleigh De
and
Leon,
he is based out of Chula Vista in the East Lake area.
Okay.
So she wants to be a singer when she grows up.
Yeah.
Just like
Yeah.
Jessica
Any,
Sanchez?
any plans of being in showbiz or something? How about Olivia? Can you talk with the mic?
Yes.
Yes. Okay. Oh, is there any particular like what is your specialty? Like a ballad song or a fat song?
Well, I like both because like slow songs I like just feel like my emotions.
Yeah.
And then fast songs I get to like be happy and
Yeah.
get my nerves off.
So you like Bruno Mars?
Yes, yes.
And
Wow.
her mom likes Bruno Mars.
I like Bruno
Yeah.
Mars too, so.
I guess it's her mom's choice.
Yeah.
Well, what a proud mother. I was looking Nolita, and while Olivia is singing, and she was like, she was the one who's very, very proud.
Yes,
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 of
very
course.
proud of her. Yes.
Yes, of course. Yes, okay. So, yeah, I mean, probably we can introduce Olivia to some other production company that
Here in the
in the
Wow.
Philippines.
Oh,
you
yeah,
know, you
that'd be
never
nice.
know.
That'd
You
be
know.
Child
nice.
star.
Yeah. But all of those popular child star right now, I mean, singers started like that. You know,
Yeah.
they started to sing like in
In every
parties, in
opportunity
occasions. Yeah.
they could get an exposure, they will sing.
Yeah.
Well, the main reason why we do singing solo, like solo performances, is just to give them some confidence, you know,
Yeah, that's
starting
true.
at an early age, which I
Right.
think is very important.
Uh-huh.
So her and my older daughter actually been taking from the same vocal coach, Raleigh De Leon. So
Oh, okay.
yeah, so we.
And can you believe that she has three kids?
Yeah, three
already?
kids.
Three
Can you
kids.
imagine
Yeah,
like
imagine
your age? Maybe you are in the 40s already.
I'm in my 40s. Yeah.
Yeah, okay.
But
So
I,
you
I
look
feel like I'm in
it.
my 20s though.
Yeah.
Exactly.
Yeah.
You don't look like your 40s.
Oh, thank you, thank you. I think
And-
it's the wonderful work of my cousin.
Yeah.
Yeah. And of course, Dr. Cenica.
Yes, I was
Uh,
asking you a question. A
There,
while
there was a
ago.
question
I'm a
before.
part-time host right now.
Okay, all right. So
The question was...
Yes.
There's a hanging question.
Yes, Dr.
Well, you
Please
guys
ask the
have been
question.
asking us what we felt, but you know, our topic is what would you feel if you were
Yes,
operating
what
on
did
a
Dr.
relative?
Seneca
Yeah,
feel
what did you feel when I
during
asked
the time
you?
of the surgery?
there
know.
was I really want to mean that there was hesitations because you know what you are operating is somebody whom you know, and
He
he's a
actually
relative.
didn't
He's not.
want to
He's
do.
is also relatives, and but you have to eliminate that thought or thinking that
Just go
it's a
through
relatives and then
Go through
just
with the procedure.
yeah, and that is just a patient and not a relative, so you will not have any hesitation doing the procedures. I was even asking her several times, do you really want the procedures done? And
yeah,
she's
he was.
and I just saw her lying on the operating room. She
Yeah.
died herself and
Because I know the
took the
SOPs
medication.
already,
She
so
was
I
there
knew
at
what to
6
do.
a.m. in the morning
Morning.
in the operating room.
Yeah, and
Waiting for
she's
Dr.
very
Seneca.
determined.
Yeah, but the thing is, you know, with relatives, I was asking, oh, come on, do my procedure in the morning. The clinic was almost closing, and then he did the procedure. That's the
Yeah.
thing with relatives. You know,
Because
they do
many
what
patients
what they
are
want.
already there, so
Yeah,
you have to
yeah.
prioritize.
I
Of course,
know,
we have to
yeah.
prioritize
Patients.
And I understand.
the
They
pay
were paying-
patients.
They were paying patients, and I
Prioritization.
was just, you know, a GC, a gratis. So it's fine, you know. I have all my time.
So
here.
your procedure was done under local anesthesia? wasn't
Yes, it was
so
under
you
local
were
anesthesia.
awake.
I
during
was
the
How,
awake.
how does it feel to have that procedure done? I mean, especially with relatives, you know.
Sort of. Mine was, you know, of course it's, you
What
know.
was going on your mind?
Yeah.
Of course, I had 100% trust because I know if
Of
you know my
course,
dad
yes.
did something wrong, I'm gonna blame him all my life. You know? I'm gonna tell him, see what you did.
Morning, afternoon,
Yes,
evening?
he's gonna see me every day, and he's just gonna want to fix whatever he's done wrong. So I was really confident. I was
100%,
100%
100%
confident, of course, because you know he's my dad, and
Yeah.
who else would you know would protect me or you know do something good for me but my dad. So I was 100% confident.
So you're talking during the procedure. You're joking.
Oh, he
inside
was
the
joking
procedure?
around. Maybe that's a difference when you're doing a
Sometimes when the
procedure
doctor
to a
jokes around,
relative.
it helps.
Yeah, it
With
really
the
helps.
tension,
you
with the
relax.
tension.
Well, we were discussing about these topics because this also happens almost every day.
I'm sorry.
That some of these also doctors doing procedures to relatives, and this is what we feel. This is the real thing, you know.
Yeah.
This is the real truth,
That,
and
the tension is high when you do a procedure,
tension is
especially
very
when
high.
you do a relative.
but we're just like what Dr. Lau is saying is that we're just doing like we're having some jokes around, but just to release the tension. Yes, of course.
And probably you know not just because you guys are my relatives, but of course you guys are professionals. That's why it's not just because they're your relatives. That's why you're comfortable. You know that you're in the right place with the right people handling your
Yes.
procedure. That's why you become very comfortable.
That's why we're very comfortable also talking to you guys because you're relatives, you know.
So after the procedure, doctor, 2 procedures, right?
Yes. Recently I just had my buccal fat
Only
removal.
two.
Fat
only
is
two
like what?
procedures.
For
Yes.
patients who have like a puffy face, there's a solution right now. It's like what Dr.
Yes. And
Cenica
Yes,
had.
it's
It's a
called-
one-time thing.
It's a one-time thing.
Yeah.
It's called buccal
Does it
fat
really hurt? I
removal.
mean, you know, they feel like, oh, there will be more excisions here, but it's not.
no,
you
no,
know.
no.
The
No
excisions is
excisions
just
at all.
inside the mouth.
It's just like when you've undergone tooth extraction, something like that.
Much
but
less pain.
less pain because it has local anesthesia all
The
over
good thing
it.
about the buccal fat removal is if you could focus at the doctora's
Come
face.
on.
No. You cannot see a scar.
Yeah,
on
there's
her
no
cheek.
scar.
There's
No
no scar.
scars.
It's
It's
just- it's just inside the mouth. It's
Scarless
inside the mouth.
procedure takes about 15 minutes only
Yes.
to
Yes.
do the procedure.
You do that a lot, huh?
Yeah, he
Yes,
does
and then,
that.
after 5 days, you could see that your face will be thin.
And actually, even if after a few months, it's still, it's still
The
getting
swelling is
thinner.
going down.
Yes.
The
Yeah, it's still
swelling
getting thinner even if after a few months.
So let's talk about stem cells now.
Yeah,
Okay,
go.
the stem cells
Johnny.
is like, as I've said, this is regenerative medicine. And there's really, just like Johnny here, who is my brother-in-law, there's really a lot of patients coming from other countries
Interested in
because like
stem cells,
part of the
yeah.
medical tourism, just to have the stem cells done here. One thing more because the technology here is a little bit it's better, more better than any other
It's
countries.
advanced.
And
More
plus, there's less controversies. In other countries, there's a lot of laws and controversies regarding stem cells. But here, we're not relaxed, but rather we're really doctors who've been doing stem cells are trained by the people from other countries too.
And the
You
good
know.
thing about here in the Philippines, we practice stem cells. We use only autologous.
Autologous
We
fats.
don't use any
other,
materials
like,
from other species, black sheep.
We don't use embryonics like
Yes.
from the babies or from the umbilical
It's
cords.
just
you know.
purely autologous.
Autologous
stem
Yeah,
cells.
it
means
just
it
came.
comes
That
from-
means it came from your own body, from the patient's
Not even
fats.
your relatives.
Not even your relatives. That just came from that.
Okay.
And Johnny, yes. We will, what do you feel right now? Do you have any hesitations of having stem cells? Is that really you really plan for it? Because it was like several months when you called me. Okay, I'll do it, John, and I'll
Right.
be going to the Philippines on January, and we'll do it.
No, I talked to my wife and my family about it, and I was really confident out of the stuff that I was reading about it, and like I said earlier, I have the utmost confidence in you, and I know that if it was something that you didn't want me to do, you would tell me that maybe at this time it's not feasible. Maybe you should wait and think about it and try it later on, or maybe something new in advance would come out. But what I've read, it's I'm ready to do it.
Because there's a lot of patients right now who doesn't know anything about stem cells,
Yeah.
and people who really been interested with that is somebody who's really had a problem, medical problem.
Medical problem.
And then they keep. I mean, I always dare my patients to search about it, to think about it, and take a look of the research that's been going on right now. I mean, worldwide, globally, and regarding stem cells. And I don't want them like to think that this is just a house show treatment, but it's documented that there's a lot of procedures and studies going on right now regarding stem cells. It's good in the Philippines that there's several doctors who have been very interested of doing stem cells because we know that this might be the future of medicine.
Exactly.
Can you explain like the procedure of stem cell, like so that we can better understand
Just
number
a
one why we would
preview?
want to do it and
Yeah.
and what the process is and the result.
Is it an operation? Is
Yes.
it
Oh, but before I was answering that, we have a texter from
Okay.
cell phone number
98.
9856, Doctor.
Question for Dr. Jonah and or Nolita. In the future na magkaroon kayo, Doc Jonah, ng daughter, willing ka din ba i-encourage mag-undergo
Undergo
na
na
operation like yours?
From
Nolita
Manila.
first because
Oh, maybe she-
That's a very good question. Very good question. I actually, my older daughter was requesting, to come to Philippines so that she can have her.
How old is
Yeah.
she?
She's 16 right
16
now.
years
16
but
years old. Yeah.
I feel that I think after they mature a little bit more, maybe like when they're in college,
Yeah.
that they can start making those decisions as far as what's best for them. But I wouldn't hold them back from it if it's going to make them feel good about themselves.
She will let them.
Yes, I would. I
Let them
would,
decide
and
on
I
their
would
own.
trust, my kuya. So,
Thank you.
so before anybody else.
Yeah.
So, yeah. I mean, I don't have any. I don't have any.
How about you,
yeah.
John, in one
Sige,
sentence?
break muna tayo sa English. No? Magtatagalog muna tayo.
Yeah, okay.
Since Tagalog yung question natin. Para sa akin kasi, I want it for the right reasons.
Okay.
Maybe if I ask her, kung tatanungin ko siya na ano bang rason mo para
Magpa-enhance.
magpa-enhance. Kung sasabihin mo sa akin na, nag-break kami
Gagantihan
ng
ko yung
boyfriend ko,
boyfriend ko kasi
yung mga
wala
Di ba
ganon.
yun ang reason?
Something like, hindi naman.
90% only.
90%. Only
Hello
90%.
there. No. Ako, I really think, sa tingin ko talaga, the reasons are very important. Whether it's
Just to feel more
just
confident.
to feel confident. Number one, you should do it for yourself.
Yes.
Not for
Diba?
everybody.
Not for anyone else. Not
Okay.
because someone wants you to. Not because of work. You should do it for yourself. Second, is it gonna do you good? Is it gonna make you feel more confident? Is it gonna make you better at work? Because sometimes if you feel more confident, mas maganda ka magtrabaho.
Yes, exactly.
Di ba? Mas maganda yung confidence mo kapag humaharap ka sa
Yes.
mga tao. You can speak well, you can...
Wala kang
which
inhibition,
happened
wala
to
kang
me.
inhibition.
Yeah, and if I'm gonna have a daughter, kailangan for the right reasons.
Okay,
For the
we
right
have a texter again from cell phone
Very
number
well said.
ending at 0236, doctor.
Good day, doctors. Curious lang ako, which is more difficult to operate, your relatives or just an ordinary patient? Siguro. Si Dr. Cenica ang nasagot niyan.
Yeah. Oh well, yes. It's very hard to do, as I have said before. To do. That's why we discussed this, is to do a procedure to a relatives, because there's some emotional involvement, and there's a bonding between the patients and the doctor, and of course, but we have to condition ourselves to that this, regardless whether it's a relatives or not, these are all patients. We got to treat them right. You got to treat them the same. Because I have said there's an emotional involvement, because not really emotion but hesitation, because every day you're gonna see something happen, which we haven't had any case like that. It's an everyday thing that, hey, you always
You're gonna see them
They
every
always
day.
bother you.
But we treat them as patients.
The hard thing
Beautiful
about
patients.
doing your relatives is, for me, they ask for too much discount.
That's true.
Sometimes
That's
no,
true.
it's free.
Or too much discount. Yeah.
That's
Just give it to
true.
all my relatives, discount too.
Yeah. Okay, let's talk about Olivia. Okay, Olivia, I was surprised that when I saw you that you sing so good. You're like, who's your idol? I mean, your idol, idol singer.
Musician, idol musician.
Yeah.
Well, I have a lot, but like my favorite singer that I would prefer is Ariana Grande.
Ariana.
Yes,
Yeah.
my
She's a-
relatives. I mean,
She's a newer artist that
She's
has
very
come out.
pretty,
She has
From the States.
Yes, from the States, and she has a television show called Sam and Cat, and she's got an amazing voice. Kind of more in early 20s,
When I was 10
hip-hop.
years old, I sounded like that.
yeah.
And then,
And then after-
With a girl voice?
and then they enrolled
girly
me into
voice?
a
Medical school.
medical school.
And everything went
Here's what they
wrong.
got.
And look at me.
So there's hope.
Yeah. Okay. There's a question again. If let's say you have a chance again of undergoing another procedure, what
Yes.
part of your body wants to have more, enhance more, other than the procedure that you have done before?
Nolita.
That's a great question. I'm trying to think.
How about?
Are you available next week?
Yes, of course. Yeah.
I think I like that buccal. How do you
Buccal
pronounce
fat,
it?
yeah, the
Buccal
buccal fat
fat.
removal.
Yes, I think because as we age,
Yes.
the things just kind of start to sag and kind of like puffy right here, and so I think I'd like to have a little bit of cheekbone enhancement. I think that's
That would be good.
How about
Yeah, I'd be
Uncle
interested.
John?
Yeah.
Why you skip yourself?
Yeah.
Last one, because I know you guys are gonna cut me again. Just kidding. Uncle Johnny.
Sige, Johnny,
Yes,
Johnny
yes, sir.
first.
After the
Do whatever you need to do.
No,
No,
you're gonna have stem cells next
Yeah.
week.
Yes.
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 The good thing with stem cell, there's a what you call after not only the medical problem the patient, but as I've said, it has an anti-aging effect.
Right, right.
Some majority of my patients after stem cells, they get a nice skin after. I mean,
Yes,
they look
Oh, wow.
young.
And
you know.
then you also inject the PRP, or
The-
the
well,
platelet-rich plasma.
we incorporate it with what we call a platelet-rich plasma, and we have like a 73-year-old patient. Can you imagine? He's bald. It's like only few hairs, few white hairs. Then after like several months, like 2 or 3 months, a hair is growing. Black hair
And-
is growing
yes, and
after.
the hair that is growing is colored
Yeah, we
black.
were surprised of the results
Wow.
then. So
So there's
Never
hope.
know.
Yes.
I never know.
Other than stem cells, Johnny, do you want another procedure done?
You know,
probably on the face?
I've thought about it. You know, so it's like we were talking. Everybody wants to look a little bit younger. You know,
Yeah.
but you know, and you, like Dr. Jonah was saying, you have to do it for yourself, not for other
Right,
people.
right, of course.
Okay.
So
So thank you very much. We don't have so much time, and we still,
Nakalusot si Johnny.
still have a lot. We'll ask
John.
her
Oh,
on
real
the next.
quick, I'll answer that next week.
Okay. Any last word, Johnny?
no, just thank you very much. Thank you for having us, and hope you guys have a great year.
Yes. Thank you very much, Johnny. Hope we can have
See
you
next week sa
next
clinic.
week.
See you next week.
Dora?
So thank you for having me, and I'll see you next week. And guys, I'm gonna see you guys next week. And also, I would like to greet my mom and my Lola and my Tita. They're watching right now. Hello.
How about you, Kim?
Oh, yeah,
My wife
greet Auntie
Kim and my two sons. In fact, happy birthday to my son Christopher. Turned
Happy
21.
birthday.
Happy
My
birthday.
cousin.
Happy birthday.
Les, Nolita?
I'd just like to say thank you so much for having us on the show, and you know, I want to stay longer
Yeah.
here in the Philippines, and
Yeah.
if anybody out there who's from the States that is kind of questioning, you know, to have procedures done here, I would highly encourage it.
Yeah. Thank you.
You have a spokesperson in San Diego.
Yeah.
Yes.
There you go. Yes, Miss Olivia. Any word from your friends?
Say hi to your
Yeah.
friends, Olivia.
Say
If
hi.
any of my friends are watching, probably not, but I don't know. Hi, and
You want to say hi to Justin?
yeah,
Hi,
hi
Justin.
Justin, and
Grandma.
happy early birthday to my brother. That's birthdays
Today.
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 Oh.
Okay.
birthday.
Yes, I would like to greet also my uncle. Happy birthday
birthday.
today.
Tito
Well,
Narzin.
yeah, Uncle
Tito
Nar.
Narzin.
Well, I don't know if she's watching, but I know it's going to be a
He's
surprise
getting
party.
ready. He's getting ready.
Yes, I would like to greet also my ex-girlfriend. Now she's my wife, Joanne. And also my son Justin and Jo Marie. And of course, I think
Johnson staff.
to greet my
Yes, all
staff, the Johnson staff from Manila,
Pampanga, Libis,
Libis,
and the main branch, the Manila branch.
Manila. Okay, and you can also catch us at our Facebook account. It's Johnson Cosmetic Surgery, and we have a website. It's www.johnsoncosmeticsurgery.com. Our telephone number in Manila is 521-1444. Again, it's 521-1444 for any question regarding cosmetic surgery. Yes, Dr. Lau?
Yes, you can see me at Johnson in Manila. The telephone number is 521-1444. And you could also see me later on. I'll be going to Johnson Libis in number
Libis.
8 Acropolis Building in Libis, Quezon City. Our telephone number is 667-3491. Again, it's 667-3491. Batiin ko lang ang aking brother, si Ryan Lau. Birthday niya next week.
Ryan,
And
my
sa
classmate.
asawa niya si Beth, and
Yeah.
to my mom and to my dad.
Okay, yeah, thank you very much. Thank you very much, guys. And of course, this program will be replayed tomorrow, Sunday at 12 noon. And again, we have a new time slot. It's from
Yes,
12 o'clock
12
to
p.m.
1
to 1
o'clock.
p.m.
Okay, so this is Dr. John Cenica for another episode of What's Up, Doc?